I'm walking with a stick. I don't know whether it's 40 years of drug use and my body's paying me back, but it makes things a little difficult. I'd just like to say I'm thrilled to be presenting with Peter this morning. Peter was one of those early parliamentarians who, in the face of a lot of community disapproval, supported HIV programs and activities that stop the spread of HIV in our country, and it's been very successful. So it's a pleasure to be with you again, Peter, and thanks again for what you did for our community. So I'm just going to start talking about the campaign, which was Support Don't Punish, and was formally launched in 2013 in 46 cities participated that year. A year later, 100 cities were involved, and this year we know of at least 150. The campaign is gaining traction as the groundswell of support for it's expanding. There's some very simple and inspired reasoning behind the campaign's support. It's an appealing slogan, short, to understand and easily to be translated. The meaning behind it is reasonably flexible and can be massaged to different things for different regions. The artwork is easy to download and use in promotional materials. And it gives a sense of common activity and working towards sharing an achieved vision. And it doesn't call for grand gestures or individual disclosure. When the slogan was first mooted, the international network of people who use drugs were hesitant to promote and use it. Not because we didn't support it per se, rather we felt it didn't go as far as it needed to go to demand the change that we wanted. In spite of our initial misgivings, the campaign was used by so many of our members that we had to reappraise our initial assessment. The Support Don't Punish campaign falls under the rubric of harm reduction, which is a much understood and much maligned philosophical response to the previous system, which was utterly ineffective, innately brutal, which was abstinence. The basic premise is to minimise the harms that occur as a result of prohibition. Its development coincided with the HIV epidemic and provided a structural framework from which to both understand and explain the new policies that underpinned activities designed to hold BBV transmissions. Prior to this development, the only response to drug use had been jail or abstinence, and this was an enormous change in focus which a lot of people really struggled with and continue to struggle with today. Peer-based drug user organisations such as AIVL were established and funded initially to contact and educate our community about HIV and later hepatitis C transmission. The government had no idea how to speak or reach drug users, and more importantly, drug users wouldn't listen to anything they had to say. Prevention of disease that can be spread to the wider community, like HIV, or diseases such as Hep C, that will in time put enormous stresses on the health budget, are the focus of government funding. No programs are supported or funded that acknowledge the ubiquity of drug use while working to dismantle the policies that support an environment that places people at unacceptable levels of risk, including overdose, bloodborne virus transmission, and a myriad of other health and welfare inequities. Let's take a look at the number of human beings that we're talking about who take drugs. UNODC, and we can fairly sure this is an underestimate, estimates at 2012 between 162 and 324 million people had used drugs in the previous year. That's between 3.7 and 7% of the population. However, most of these people are able to use their drugs in an occasional and pleasurable way, unless they fall foul of the criminal justice system. However, it's a percentage of the figure who inject that we're talking about today. Injecting drug use has been identified in 158 countries. We estimate worldwide there's about 3 million people who inject drugs and might be infected with HIV. Hepatitis C, another bloodborne virus, has never affected the critical response that HIV did, because hepatitis was a feature of our community for many years, and because it wasn't being transmitted into the wider community and the results of infection weren't known back then, we were just let alone to get infected and go along our merry way. There was no doctors talking to us, there was no needle exchange available for us, because it was just infecting our community, and if it just infects our community, it's really not of much interest to anybody else. Globally, 80 to 90% of all new infections in high-income countries are found in injecting drug users. There's 10 million people have been infected with hepatitis C, and 8 million of those are chronically infected. The viral troika of America, Russia and China have millions and millions of people infected with both HIV and hepatitis C, and some 90% of all HIV positive are co-infected with hepatitis C. The adoption of the Single Convention of Drugs and its supplementary treaties paved the way for a prohibitionist philosophy that drives global drug policy, which in turn provides an environment for disease and other harms to flourish. On reading the conventions, one can't help but notice the pejorative and emotive language that's used. Words such as evil, which are not even used in conventions discussing terrorism and human trafficking. Unusually too, this document places a level of blame on the individual, not seen in other conventions, that usually speak to the structural problems and blockages enabling the abuses to occur. I think this helps us to understand the genesis of some of the emotion around prohibition, but because the document's written in such emotive and negative language that it allowed for those sorts of policies to flourish, because people were seen as evil and what we were doing was wrong. The conventions have to be adopted in countries and laws have to be enacted around their intent. Laws supporting a prohibitionist agenda had been passed some decades before the single convention and were based on racism, economic one-upmanship and later social control and political expediency. If we look back to the passage of the first laws in relation to drug use, they evolved at a time of huge social upheaval. Prior to this, drug use wasn't really seen as anything much. People, few people had problems with drugs, but they could buy them. There was no social, policies around shaming people or jailing them. The Industrial Revolution and the prolific expansion of cities, the rise of capitalism, religious ideology and the move to medical practitioners, a whole raft of new ways of living and experiencing the world were occurring. So from a knee-jerk xenophobic beginning, drug laws have pretty much continued to be passed as a mechanism for controlling populations, providing a political scapegoat, and as a bonus they provide an unfettered, untaxed access to money-making opportunities for the neoliberalists. Neoliberal economic theory, the one so beloved of Thatcher and Reagan, has been bubbling away since the 1930s under Friedman and the Chicago Boys. It's basically an economic doctrine that has no time for government activity or its place in ensuring that there is some social support for people. It's the free market reigns supreme and the individual is responsible for any and every aspect of their lives. Structural drivers of poverty and stigma and other social inequities have no place in this philosophy. It's an exhilarating dog whistle for the 1% and ensures they're able to expand their wealth while ruthlessly exploiting the rest of the population while telling us it's our fault. The situation in Greek reeks of the neoliberal economics today. So we find the global community is being manipulated by complementary doctrines that exacerbate the cruelty and the inherent abuses of both. Many people struggle under this regime, however people who inject bear the brunt of these policies. Stigma and discrimination targeting people who inject occurs in every facet of their lives, and it's not an exaggeration to say it's responsible for killing members of our community. The number of IUD and antiretrovirals is unacceptably low. The uptake of hepatitis C treatment where it's available to injecting drug users is less than 2%. Most countries have restriction on treating people who inject drugs, and if it's not explicit, it's certainly in practice. And despite the evidence that we participate in treatment and the outcomes are comparable to other people in the community. When we ask our community why they won't be treated, they cite again and again stigma and discrimination. It's just one too many instances of being made to feel less human, of being made unacceptable. We're now seeing the impact of hepatitis C 4 decades later. It's an ugly, cruel and painful way to die. And even in dying, drug users are punished by pain relief being routinely withheld. If we look beyond the bloodborne viral diseases affected by stigma and discrimination and look at the levels of incarceration, forced detention, members of the drug-using community can only see them as human rights abuses. At the extreme level being played out in Russia, where millions of drug users are being refused needle syringes and substitution treatment, it's effectively a population cleansing method. Families being destroyed by ineffective interventions if drug use is found to be occurring. I've been around for 4 decades now and watched the impact of discrimination on many of my friends and family, and all I've seen is the development of intergenerational trauma and disaffection, which over the decades is being increasingly played out on the poor, people of colour, people with mental health issues. In fact, anybody who doesn't support in some way or contribute to unreasonable taxes, unfair working conditions, the proliferation of private jails, listening to and gathering private information and data, and endless pitiless lists. So within this climate of political oppression and economic brutality, the work of drug user organisations is challenging. But our community is nothing if not committed. Drug use is not for the faint-hearted in this environment. Organisations such as INPUD, the global face of our community, or AIVL, the Australian peak body, together with the European group, the Tanzanian group, the Asian group, the Kenyan group, the MENA region group, are all working in whatever capacity we can to ensure our community is not always left to bear the brunt of preventable diseases, and to be excluded from successful treatments and to participate fully in our community. If three little words like support, don't punish can garner such a global response, there may be a chance that we can turn a century of inept policy and disgraceful practice on its head and develop a world that cherishes everyone, celebrates difference and keeps its nose out of people's private affairs. Thank you very much.